What if I told you that thousands of people are paying tens of thousands of dollars to have their legs deliberately broken with hammers and saws, then stretched apart for months, all to gain just 4 inches in height? This isn't medieval torture. This is modern cosmetic surgery, and it's becoming more popular every year. Welcome to the world of cosmetic leg lengthening, where the pursuit of height has no limits. Welcome back to Mind and Marvel, where we explore the most fascinating and sometimes disturbing trends in medical science. I'm your host, and today we're diving into a controversial cosmetic procedure that's gaining popularity worldwide, one that pushes the boundaries of what people will endure to change their appearance. Reports suggest that in some private clinics, cosmetic cases of limb lengthening surgery now outnumber medically necessary ones. This reflects a cultural shift where people are willing to undergo a demanding, high-risk medical procedure to meet social ideals about height. We live in a world where height can influence everything from dating prospects to career opportunities. Studies show that taller people often earn more money, are perceived as more attractive, and face less discrimination. But at what point does the desire to be taller become dangerous? Limb lengthening surgery was originally developed for children with dwarfism, bone deformities or injuries that left one leg shorter than the other. It's a legitimate medical procedure that can dramatically improve quality of life for people with genuine medical conditions. But now, healthy adults who are simply unhappy with their height are undergoing this grueling procedure. Men especially are seeking these surgeries, with some traveling internationally to countries where regulations are less strict and costs are lower. So what exactly does limb lengthening surgery involve? How does deliberately breaking your legs make you taller? What are the real risks and complications? And why are so many people willing to endure months of pain for just a few extra inches? Let's explore the science, the psychology, and the controversy behind this extreme pursuit of height. To understand how limb lengthening works, we first need to understand one of the most remarkable capabilities of human bones: their ability to regenerate and grow when properly stimulated. Your bones aren't static structures, they're living tissues constantly breaking down and rebuilding themselves. When a bone breaks, specialized cells called osteoblasts rush to the injury site and begin laying down new bone material to bridge the gap. The technique of controlled bone lengthening was developed by Soviet physician Gavril Ilizarov in the 1950s. He discovered that if you gradually separate the two ends of a broken bone, just a tiny amount each day, the bone will continuously generate new tissue to fill the gap. Doctors perform leg lengthening by surgically breaking the bones of either the upper or lower leg, and then inserting a telescopic rod or nail. That device expands inside the bone with the help of an external remote control. The bone constantly tries to heal itself, as one surgeon explained. The process is called distraction osteogenesis. After the bone is surgically broken, patients wait about a week for initial healing to begin. Then, using either an external frame or an internal magnetic device, the bone segments are slowly pulled apart by about 1 millimeter per day. There are two main approaches. The traditional Ilizarov method uses external metal frames with pins that go through the skin into the bone, while newer techniques use internal telescopic nails that can be extended using magnetic remote controls. The Precice system utilizes a telescopic intramedullary nail with a magnetic motor inside. The nail is inserted into the bone through a small incision, and patients can control the lengthening process from home using a magnetic remote control device. The entire process is grueling. Patients undergo the initial surgery to break the bones and insert the lengthening device. Then comes 4 months of daily lengthening, where bones are slowly pulled apart while new bone tissue grows in the gap. Finally, there's a consolidation phase lasting another 6 months, where the new bone hardens and strengthens. During the lengthening phase, patients can see their legs literally growing longer on X-rays. New bone tissue appears as a lighter, less dense area between the original bone segments. This is called the regenerate bone, and it gradually becomes as strong as the original bone. Throughout this process, patients have severely limited mobility. With external frames, they can barely walk and need assistance with basic activities. Even with internal nails, weight bearing is restricted, and patients often require wheelchairs or walkers for months. Most patients can expect to gain 4 inches, 5, 10 centimeters through this procedure. Attempting to lengthen more than this significantly increases the risk of complications, as muscles, nerves, and blood vessels become severely stretched. Now let's talk about what medical professionals don't always emphasize in their marketing materials. the serious risks and complications that can turn a cosmetic procedure into a lifelong nightmare. The UK's NHS has warned that the procedure can, in some cases, cause permanent disability. Studies show that complications occur in a significant percentage of patients, and some of these complications can be life-altering. Infection is one of the most common complications, especially with external fixation methods. The pins that go through the skin create pathways for bacteria to enter the bone, potentially causing osteomyelitis, a serious bone infection that can be extremely difficult to treat. As bones are lengthened, the surrounding muscles, tendons, nerves, and blood vessels are stretched beyond their normal limits. This can cause permanent nerve damage, leading to numbness, weakness, or chronic pain that never fully resolves. Hardware complications can include potential issues with the internal nail, such as breakage or migration, which may require additional interventions. Some devices, like the Precice stride method, were discontinued in 2021 due to concerns regarding corrosion. Many patients develop joint stiffness and reduced range of motion that persists long after the procedure. The prolonged immobilization and tissue stretching can result in permanent limitations in knee, ankle, and hip flexibility. Most complications related to patient discomfort and psychological stress, which were important issues in this type of patient. The months of pain, limited mobility, and social isolation can trigger depression, anxiety, and other mental health issues. Sometimes the bone simply fails to heal properly, a condition called non-union. This can require additional surgeries, bone grafts, or in worse cases, can result in permanent disability and chronic pain. As bones lengthen, muscles don't grow at the same rate. This can lead to muscle contractures, where muscles become permanently shortened and tight, limiting joint movement and causing ongoing pain. The prolonged immobilization increases the risk of blood clots, which can be life-threatening if they travel to the lungs. Some patients require blood-thinning medications throughout the recovery period. A significant percentage of patients require revision surgeries to address complications, remove hardware, or correct problems that develop during healing. Each additional surgery increases risks and extends recovery time. Long-term studies show that while many patients are satisfied with their increased height, a substantial number report ongoing pain, stiffness, and functional limitations years after the procedure. Some describe the experience as the worst decision they ever made. Many patients travel to countries with less stringent regulations and lower costs. But this often means reduced safety standards, less experienced surgeons, and limited options for addressing complications that arise after returning home. To understand why people undergo such extreme procedures, we need to explore the profound psychological and social impacts of height in our society. Height discrimination is real, measurable, and affects millions of people worldwide. In the world of online dating, height filters are among the most commonly used criteria. Studies show that women often prefer men who are at least 6 feet tall, while shorter men face significant disadvantages in romantic relationships. Research consistently shows that taller people earn more money and are more likely to be promoted to leadership positions. Each inch of height correlates with approximately $800 more in annual salary. For men under 5'7", these disparities can be particularly pronounced. Height affects how others perceive competence, leadership ability, and attractiveness. Taller individuals are often assumed to be more capable, more intelligent, and more trustworthy. Biases that can significantly impact life opportunities. Patients describe feeling invisible, overlooked, or dismissed because of their height. Many report being turned down for jobs, rejected in dating, or bullied throughout their lives. For them, the surgery represents a chance to finally be taken seriously. Different cultures have varying height expectations, but social media and globalization have spread Western beauty standards worldwide. In some countries, being taller is associated with success, prosperity, and social status. Some patients develop what psychologists call height dysphoria, an obsessive preoccupation with their height that affects their daily functioning, relationships, and mental health. Like other forms of body dysmorphia, it can drive people to extreme measures. Social media amplifies appearance pressures, with filtered photos and idealized bodies creating unrealistic standards. Height becomes just another physical attribute to be optimized, regardless of the costs or risks involved. The high cost of the procedure in developed countries, often $75,000, $150,000, drives many patients to seek treatment in countries where it costs $15,000, $30,000, despite increased risks and lower safety standards. Online communities have formed around height surgery, where potential patients share experiences, compare surgeons, and encourage each other through the process. These communities can normalize the procedure and downplay risks. Responsible surgeons require extensive psychological evaluation before approving patients for cosmetic limb lengthening. However, some clinics prioritize profits over patient welfare, approving unsuitable candidates who may not be psychologically prepared for the ordeal. Mental health professionals argue that therapy, self-acceptance, and addressing underlying body image issues might be more effective than surgery for many patients struggling with height-related insecurities. The rise in cosmetic limb lengthening has created a global industry with varying standards, ethical practices, and regulatory oversight. This has led to concerning trends in medical tourism and questionable marketing practices. The dramatic cost differences between countries drive medical tourism. While the procedure might cost $100,000 in the United States, patients can find surgeons charging $20,000 in Turkey, India, or other countries with lower healthcare costs. Many clinics aggressively market their services on social media, using before and after photos, patient testimonials, and promises of life transformation. Critics argue that these marketing campaigns downplay risks while overselling benefits. Not all surgeons performing cosmetic limb lengthening have equivalent training or experience. While some are highly skilled orthopedic specialists, others may have limited experience with the complex complications that can arise. Regulatory oversight varies dramatically worldwide. Countries with strict medical regulations may limit who can perform the procedure and require extensive patient counseling, while others have minimal oversight of cosmetic surgeries. Ethical practitioners require comprehensive medical and psychological evaluations, detailed informed consent processes, and cooling-off periods before surgery. However, some clinics may rush patients through these processes to maximize profits. One major concern with medical tourism is aftercare. Complications may arise months after surgery, when patients have returned home and may struggle to get appropriate treatment from surgeons unfamiliar with the specific hardware or techniques used. Most insurance policies don't cover complications from cosmetic procedures performed abroad. Patients may face enormous medical bills if serious complications require extensive treatment or revision surgeries. Major orthopedic surgery organizations have expressed concerns about the rise in cosmetic limb lengthening, emphasizing that it should only be performed by experienced specialists with appropriate facilities and support systems. Patient advocacy groups are pushing for better-informed consent processes, including mandatory cooling-off periods, comprehensive risk disclosure, and psychological screening to ensure patients fully understand what they're undertaking. More research is needed on long-term outcomes and patient satisfaction. While short-term studies may show positive results, the full impact of these procedures may not become apparent until years later. The medical community remains divided on cosmetic limb lengthening. Some argue it's no different from other cosmetic procedures, while others believe the extreme risks and lengthy recovery make it unethical for purely aesthetic purposes. Despite the risks, demand for cosmetic limb lengthening continues to grow worldwide. Understanding current trends helps us see where this controversial field is headed. The typical patient is a man in his 20s or 30s, often from middle to upper-class backgrounds with the financial means to afford the procedure. However, the demographic is expanding to include more diverse age groups and backgrounds. Certain countries have emerged as popular destinations for height surgery, including Turkey, South Korea, Russia, and India. These locations offer experienced surgeons at lower costs, though standards and outcomes can vary significantly. Surgical techniques continue to evolve, with newer devices promising reduced complications and shorter recovery times. However, each new technology comes with its own learning curve and potential unforeseen risks. Social media plays an increasingly important role in driving demand, with patients sharing their experiences and outcomes online. This creates both awareness and social pressure around height enhancement. Some governments are responding with increased oversight of cosmetic surgery advertising and medical tourism. However, regulation remains inconsistent globally, creating opportunities for less scrupulous practitioners. Researchers are exploring less invasive alternatives, including growth hormone therapies for appropriate candidates and non-surgical approaches to addressing height-related psychological issues. So there you have it, the shocking reality of cosmetic limb lengthening surgery, where people willingly break their legs and endure months of pain for the chance to be a few inches taller. We've explored how the procedure works through controlled bone breaking and regeneration, The serious risks and complications that can result in permanent disability, the psychological factors driving people to such extremes, and the concerning lack of regulation in this growing industry. While some patients report satisfaction with their results, others face lifelong complications, chronic pain, and regret about their decision. The pursuit of height comes with real, measurable risks that can't be ignored. For anyone considering this procedure, the key is thorough research, comprehensive medical and psychological evaluation, and realistic expectations about both outcomes and risks. If controversial medical topics and the extremes people go to change their appearance fascinate you as much as they fascinate me, make sure to subscribe to Mind and Marvel and hit that notification bell. We explore the intersection of medicine, psychology, and human behavior in ways that will challenge your assumptions. I want to hear your thoughts in the comments. Do you think cosmetic limb lengthening is a legitimate personal choice or dangerous medical overreach? Have you ever considered extreme measures to change your appearance? What's your take on the psychological factors driving these decisions? Remember, your body is the only one you'll ever have. Every medical decision, especially cosmetic ones, deserves careful consideration of both the potential benefits and very real risks. Thanks for joining me on this exploration of one of medicine's most controversial cosmetic procedures. Until next time, keep questioning, keep learning, and keep making informed decisions about your health.